China is preparing for an alarming rise in COVID cases. It is expected to infect as many as 65 million people in a week by June. The Chinese authorities are rushing to push out vaccines to combat the ongoing wave of the coronavirus. Since April, China has witnessed a surge fueled by Omicron variant XBB. By this month's end, the country will likely report 40 million infections in a week, before peaking at 65 million weekly by the end of June, as per local media reports. The new XBB variants of the virus are evolving to overcome the immunity developed after China's abrupt departure from its zero-COVID policy last year. The outbreak could be the largest wave of infections since China scrapped its zero-COVID policy in December 2022. Back then, a different Omicron sublineage probably infected 37 million people every day, sending residents scrambling for limited supplies of fever medicine, overwhelming hospitals, and leaving crematoriums across the country with piles of bodies. Notably, China has implemented stringent control measures earlier in the pandemic. About 6 months ago, China had dismantled its extensive COVID response infrastructure, including strict lockdowns, widespread testing, rigorous quarantines, and stringent mask mandates. The massive surge has people in China scrambling to stock up on supplies. The healthcare system in the country is also under strain. China has stopped providing weekly case updates, making it challenging to ascertain the accurate scale of the current outbreak in China. The US is monitoring the new wave of COVID cases in China. However, they did not disclose whether traveling restrictions were being considered. Although there was an increase in infections in the US due to the new variants, the public health emergency was nevertheless proclaimed to be over on May 11th. However, specialists have not ruled out the possibility of new variants causing another wave of illness in the years to come. Meanwhile, China is also preparing to roll out new vaccines that will target XBB. 2 new vaccinations for the XBB Omicron subvariants have been given preliminary approval. The batch of XBB-specific vaccines will add to a growing number of homegrown immunizations. It is in line with a recommendation from an expert panel recommendation at the WHO last week to move away from using the original Wuhan strain in future shots. According to the Beijing Center for Disease Control and Prevention, the variations have increased the number of cases since last month, with COVID surpassing the flu as the most prevalent infectious disease over the final 2 weeks of April. Officials in China, however, claim that the current wave will be less severe. The public has been reassured by health experts that reinfections have milder symptoms. Restrictions similar to those that existed during the zero-COVID era have not been reinstated. The majority of citizens seem to be going about their daily lives as usual. The development came weeks after the World Health Organization said that COVID-19 no longer qualifies as a global emergency.